you. Turning back to the clown murder case now. Investigators plan to reveal more about the case coming up about 10 o'clock this morning in just about 20 minutes or so. But just the thought of this case is pretty hard to understand and make sense of. Why the clown outfit? So joining us right now is Dr. Ralphie Wald, a clinical psychologist. Thank you so much for being here this morning. You know, this has got a lot of us talking, not only here in Palm Beach County, but also across the whole country, because it is such a disturbing story. To think that somebody purposely dressed as a clown with the intention of murdering someone, what type of individual is that?
I want to make this clear. This is a weird story. I mean, this is not something that you see every day, even when you're a psychologist and you hear about different kind of bizarre things. I think that there's a lot of possibilities as to why she decided to dress up like a clown. There's the possibility that there was some kind of, I would say, the equivalent of a private joke between the two that obviously was not a joke, that the clown had some relevance between the two of them. There also is the possibility that she was psychotic at the time. Psychosis really just means that a person has lost touch with reality, which would basically mean there was some logic in her head that really wouldn't make sense to anyone else that would dictate, okay, it makes sense for me to dress up like a clown and murder this person. The other possibility is just that she wanted to visit as much pain and fear on this person as is possible before she killed her. I mean, imagine seeing a freaky clown right before you died. That's what I would consider to be the equivalent of psychological torture.
Can you define more what psychological torture involves, what exactly it is?
Psychological torture really is the same as any other kind of torture, except it's without any physical contact. So in other words, you wouldn't be hitting the person, you wouldn't be using any props to apply to the person. It's using words and an environment in order to scare a person.
And of course, you know, just recently the movie It, the remake, came out, and that uses a clown in the movie. And clowns within society are often considered to be fearful or to be feared. They're always kind of have an evil twist to them. Do you think that perhaps this alleged murderer knew that going into this act?
Yes, absolutely, because on the one hand, one way you can look at it, we're obviously waiting for a lot more details about it. You can look at it one way and you can say, well, she knew exactly what she was doing. She knew that clowns are scary. She wanted to scare this person. She wanted to torture this person before she killed her. Then on the other hand, you might say, gosh, it's just so disorganized. Why would someone think to do that? So you might say, yes, there's a possibility that she's psychotic. There obviously we need a little bit more details. There's a range of possibilities, but for sure she had a diagnosable mental illness, and once we have a little bit more detail, we'll be able to know, was she just a sociopath who she knew exactly what she was doing, she wanted to torture a person, or was she, again, more psychotic and she didn't really understand what she was doing? She was with it enough to be organized enough to go to the store and get a clown costume, put herself together, but beyond that, she really just did not have her act together.
And doctor, thank you so much for joining us. It's such a hard case for us to understand because it doesn't make sense in our minds.
It is a bizarre one, that's for sure, yeah.
And I'm sure we'll be learning a whole lot more. To read more about Dr. Wald's take on this clown case murder and other issues, please visit his website. We do have a link to it on WPBF.com along with this interview. And then again, in about 20 minutes or so, we'll be learning a whole lot more about that murder case, Aaron.